So good afternoon, everybody. I welcome you to our Family Advisory Council. We're really excited for you to join us today in the space where we're able to provide some updates about different things happening here at the department, but also have an opportunity to hear from you and have a discussion about how things are going currently in Ohio. As we get started, my name is Corey Ferguson, and I am with the Ohio Life Force Nexus here at the department. And again, I welcome all of you. As we get started today, just a couple of things. If you are new to the Teams platform, there is a space for you to turn your video on and off. We'd love to see your face. We do ask that you remain muted if you're not speaking, and that way we can have really good call quality for everybody in attendance. There is a chat function that you are welcome to use to put questions or thoughts inside there. We will be monitoring that. And if you should happen to leave the meeting, you can hit the red box that says leave, and that will dismiss you from our time together here today. So one of the other things I'll share is this session is being recorded, and we will post this on our website for any families who weren't able to join us today. So it is being recorded. We do have a very, very busy agenda today. We are going to start with an update from our community life engagement team, as well as hear from our Ohio ISP team for some updates of what's happening in that space. We'll have an update from our Medicaid and development team, as well as hear updates from the Ohio RISE folks about what's happening in the Ohio RISE space currently here in Ohio. We do have a brief presentation from OOD to talk about the summer work program that they have, and then also a brief presentation from DD Council about DD Awareness Day, which will be in March of 2023. We'll have family updates, and then we will also move into time with our leadership for folks to have a conversation about what things that they would like to discuss in that space. So we are looking forward to that. And with that, I will go ahead and get us started since we do have quite a full day. And Keith, I'm going to turn it over to you. I really appreciate you being here today and sharing some updates about what's happening within the community life engagement space.
All right, thanks, Corey. Is it okay if I share I have a little
Absolutely.
PowerPoint. Okay, cool. Hey, everybody, thanks for letting me be on for a little bit. Let me know if you guys can see that.
We can.
Perfect. Hey, Kate Fatma, it's good to hear your voice. Thanks for being on. So anyway,
you know, I'm always your administrative assistant in meetings like this, right?
I know you got my back. I appreciate it.
I do.
So basically, I'm Keith Banner, and I'm the statewide manager of the community life engagement team, and I'm going to do a little kind of slide deck shuffle for you for some updates from the world of the Ohio Technology First Initiative and the Employment First Initiative, which is under my kind of umbrella. And basically, I'm going to start with talking about some supportive technology first grants that we're either in the middle of in this biennium or we're awarding. And there's a lot of them because we really are kind of focusing in on building technology as a solution and an innovation for folks in Ohio. And I'm going to share with Corey the PDF version of the slide deck because each of my slides has an more info here link. So you guys can go to that link if you want to get more info. I'm going to go as pretty briskly because I know there's a full agenda. So these are the tech related grants that my team and I are kind of helping move forward. We have an innovative tech solutions grant that's helping providers, county boards, and others in the field kind of pull together projects and ideas to kind of make transportation more accessible, make remote supports more accessible, and assistive technology across the board. You can find out the awardees and some of their projects, and even see some of their work at that link below. We're also working on supporting intermediate care facilities to kind of look into how supportive tech can support the people that they support. And we have grants out to Echoing Hills, REM, and I can't remember the other one, but I'll come back to me in a second. Again, there's more information at that link. The Supportive Tech Developmental Center Consulting Project is Ken Smith from Ability Tech. He's visited all 8 of the developmental centers in Ohio and was able to talk to people who live there, support people, management, and just kind of building some recommendations and reports for each of the 8 to kind of move into innovative ways to use tech. These last couple of grants are in process now. We had an RFP out around helping residential providers who are interested in supportive tech and remote supports to get a subject matter expert to go in-house with them and help them establish how they could do remote supports and technology. So that's in process now. And we just awarded grants to housing corporations around how to build technology, supportive tech ideas into the infrastructure of housing organizations that support people with developmental disabilities. And this last one is a supportive tech training project with 3 subject matter experts from Charles Lee Center, Safe and Home, and EconSys, 3 organizations that gave us really great subject matter experts to run virtual trainings, live trainings, and videos. The last one we had was Safe and Home let us go behind the scenes at their control center, where they kind of are where the remote supports happen. So you can see the other side of what it looks like, the monitoring and the staff that kind of are there for folks who are in remote supports. Again, you can click on that link when you get the PDF for more info. Wanted to also stand up this report that came out a few months ago around the DSP workforce crisis and how technology might be able to be a solution to some of those issues. This is a 6-page, really important white paper that walks people through how tech and the workforce crisis can kind of support each other. And at that link, you can see the 3 Ohio tech goals we've established to move the system forward. This is a link to our Ohio Technology First webpage, which houses all sorts of information around the tech goals I just mentioned, around what remote supports are, what assistive tech is, guidance around the HCBS waiver services, remote support and assistive tech, just an all-encompassing hub for all the information you need to know about technology first. You can go there, and it houses the Tech First Task Force information as well, which is a task force made up of Ohio state agencies that support people with disabilities to kind of look at how technology can help people's lives. You can, when you get the PDF, you can subscribe to our monthly tech update, which comes out, I think, the 3rd week of every month, with videos, stories, pictures around some of those grants I talked about, what that's looking like, around videos we're making, around information from folks, families, providers, around how they're looking at and using technology. So that's enough with my tech first. There's a lot more, but I'm trying to go as quickly as possible. I want to introduce you to the newest team member on the community life engagement team. Her name's Ann Tapia, and she's in Southwest Ohio, and she replaced me because I moved into the statewide manager a few months ago. She's a great resource, great person, and you can link there for more information around the whole team, but I just wanted to introduce you to her, and she's the Southwest CLE project manager. Under the Employment First sector in our group is the Building Innovative Service Models grants that we have out for the 22-23. We awarded 9 employment and adult day providers funding to get support from subject matter experts to think about moving from facility to community, and also to think about how they can better support people with complex needs. They're in the implementation phase of the plans they created, and part of their grants will be road shows and roadmaps to walk all of us through how they did what they're doing. So there's more info here to that link, and you can kind of hear about what's happening, but we'll also probably have a webinar around each of their accomplishments and their road shows coming up after the June 30 end of the grant period. I wanted to give a shout out to our outcome tracking system, which is in its 4th year of operation. Basically, it captures how people who receive ED services are spending their days around employment and non-work support. It's a 6-question questionnaire that providers answer, and then all that data gets kind of aggregated and analyzed, and we were able to kind of tell a data story around the system and how it's working. The reporting period in 2021 had a 71% statewide completion rate, which is great. And we noticed that there was a 21% increase in community jobs statewide based on the OTS information. All things OTS are located at that link, when you get the PDF. We also have some transition and employment first information for you. There's we updated the transition toolkit on our website at the Employment First website, so you're welcome to look at that. Basically, videos, tools, all kinds of resources around how to do multi-action planning, how to kind of look at transition in a fresh, innovative way. We also are working with all the partner agencies that are a part of the Employment First Task Force to train the trainers around establishing families as partners in the transition process. We have, I think, 6 cohorts that are out in the field. Down here in Southwest Ohio, we work with the Cincinnati Public Schools to kind of work with OOD, parent mentors, teachers, intervention specialists, everybody get at the table talking about how we can better reach out to families and make sure they're included in all the decisions around transition planning and school. And this link here is on the Employment First website. It starts with families, which is a publication O'Cally came up with that's really great and kind of aligns with the Establishing Families project. This grant is in process, but it was in partnership with Ohio Department of Ed around pathways to careers. It's a big, great grant to organizations that are interested in supporting young adults with DD to kind of look into industry recognized credentials and apprenticeships that might lead to higher pay and benefits and careers. So we had a really good turnout of proposals, and that's in process now. We'll be awarding that soon, so stay tuned for that. Then also we've had a RFP out for building trainings and online trainings and live trainings for development and training on financial and digital literacy for folks with DD, and then also transition to adult health care for youth, and that'll be coming out soon as well. This is on the Ohio Employment First website as well. We do a fear factor almost every 2 months where SSAs, case managers, families, people with lived experience, all around the idea of the fears we have around if I want to work, but I also need benefits, how that kind of aligns. And so we've walked through with on Monday, it was about 240 people, usually around 300 to 400 people, just kind of being able to ask questions of experts that we have on around everything from SSI to Medicaid buy-in to stable accounts. And all of these episodes are up on recorded with supporting materials on the Employment First website at that link, which you can go to. And I tried to go as fast as I could. Sorry. This is me. And you can always reach out to me with any questions or give me a call. I'm always available. And thanks for listening.
We really appreciate the update, Keith. Thank you so much. And as you had mentioned, you can provide me the PDF, and I will make sure I send resources and links out to all of the emails that were used for registration today. More than happy to share those out. So
I'll send that to you right now. Thank you, Corey.
Perfect. Any questions for Keith about any of the updates? Wanda, I think you have your hand up. I'm going to have to ask you to unmute, Wanda.
There. Can you hear me?
We can.
Okay, thank you. Thank you for that. I'm half asleep here. I'm a parent. Your last PowerPoint slide of the fear, I would like to get information about stable account. What's your website? How do I access that information?
I'll put that information in the chat and hopefully you'll get it. But if not, you can email me or I can email you with a bunch of information. They have their own website and we have other stuff that you can look at as well. So I'll put that in the chat and hopefully you'll get it, Wanda. But if not, let me know, okay?
Appreciate that. Thank you.
For sure.
And I will include a link to stable accounts in the follow-up email that I send out to everybody with resources as well.
Okay. Appreciate it.
Thanks, Wanda.
Shall I mute myself again, or I don't want to be seen as interrupting.
Oh, no worries. Yeah, go ahead and mute if that's okay. Well, Keith, we appreciate the updates. Thank you very much for the work that you and your team are doing. It's very, very helpful to many of our families and people that we serve. So thank you. I'm happy now to introduce Beth Chambers, who is leading our work with the Ohio ISP throughout Ohio. Welcome, Beth. How are you?
I'm great. Thanks, Corey. As Corey said, I'm Beth Chambers. I'm the statewide Ohio ISP manager. and really happy to be here today with all of you. Again, I'll try to be brief. Like Keith, I just want to give some main themes and highlights since the last time we met. Just want to say that we continue to be excited about Ohio ISP. It's happening. People are making the transition. We're having great conversations in trying to listen and learn about people's experiences as they transition. We currently have over 1,000 plans entered into the system. And as we talked about before, some of those plans are directly entered into Salesforce, the DoDD system, and there are also outside vendors where the same content is used and it's entered into the vendor system and it transmits to the DoDD system. So this standardized plan for everyone, it can be done a lot of ways, but it all is housed there. And we want to just re-emphasize the why, that it really is to get some consistency, to get at better conversations with people, have this be a conversational experience that grows and develops with the person. Recently, the director sent a message out, and it was really listening to people's feedback about they were worried about the length of time it was taking and how they were going to meet the deadlines within the rules. So the decision was made to extend the deadline for transitioning to Ohio ISP until June 30th of 2024. So that allows county boards and ICFs time to really get familiar with this process, get teams ready. A lot of that pre-work is really communicating with families and team members and letting people know what to expect and how this is going to roll out. And we've developed a lot of resources that are standardized in helping teams empower each of the team members and to kind of get ready for this transition and doing things the new way with the assessment planning process used throughout the state. So county boards and ICFs now have until June 30th of 2024, and it is required that people receiving waiver services and living in ICFs are transitioned to Ohio ISP by that date. The template obviously can be used for anyone. So it is intended to grow and develop with people. So we're working with people. We have support teams. We have regional support facilitators that are helping people utilize those standardized resources that we've developed, helping them if they want to need some input on their plan of how they're going to transition, timelines and those things. And really that communication out to team members, and timing is critical. We want to make sure that as people start to hear about the Ohio ISP and they have questions about what they will experience and when they will experience it, to really, we can work as that liaison to help foster that communication, because we don't want any surprises. We want people to know what to expect. We have obviously heard that the process takes a little bit longer at first. So really working with people to see how we can get people familiar with that, to utilize what they already know about people, to build and expand. And then we are obtaining feedback from people as they experience the Ohio ISP process, and really tracking all that, collecting the data, analyzing that to use for enhancements to improve the experience all the way around. And want to just say that there's a lot going on behind the scenes. We're hearing from people about certain areas, like if someone has complex medical needs, how does this plan work for them? We've heard that the character limits were a barrier. And so already we have increased the character limitations. So now teams are able to add more of that critical information. We want to support, we want to listen and learn and make the changes that are needed, the critical changes. Then we're prioritizing everything else so that we can make scheduled, standardized changes along the way based on that feedback. I've been happy to work with Corey and his team, and we're going to work with all of our internal teams to really see how we can collaborate to support all team members in this process. And we've heard a lot about complex needs and how those fit into the Ohio ISP. So we've had some great discussion about moving forward. How do we take the Ohio ISP, get some examples out there, and really get in there and support teams as they navigate through doing this assessment planning process a new way. So how do we enhance the experience? How do we show people that this process can work for everyone? So I'm excited to continue those conversations and to share any information we have along the way with all of you.
Thanks for the updates, Beth. I really appreciate it. And for anybody on the call who may not be familiar, can you talk about real briefly what the Ohio ISP is and what the system was like before and what we're building now?
Yes, we have 88 different counties and over 450 ICFs. So there are about 500 or 5,000 ways that planning is taking place currently. So we did a lot of town halls and really got feedback from everyone. And what we heard loud and clear is that the assessment and planning process, people didn't feel good about it. So it was hard when people moved from county to county. If someone moved from an ICF to a county, to a waiver home out in the community, it was very hard it felt like starting over is what we heard from people. So this is a way to have one standardized template assessment planning process for everyone throughout Ohio, that it starts with, getting to know the person. It starts with the section about all about me or the introduction page to say the key important things for people, to include the contact page, to have assessment areas, what's important to people, conversational assessment, carry over to planning, pre-populate when necessary to remind people so that there's nothing lost in translation. And really starting with communication. We felt like that was one of the things we heard loud and clear, that lots of times people were not listening to a person, learning and in establishing the way they communicate. We would see in a lot of plans that the person was unable to communicate or NA. So now there are person-centered planning tools that are built into the assessment and planning process with the Ohio ISP. There, it starts with communication because that is the foundation. However someone communicates, finding the person who can help, who knows the person best. If they're unable to use words, starting there, really just building and growing, learning more, discovering more, and adding to the plan. The intention was to simplify, standardize, and really keep in mind that portability, that in Ohio, people do move around. The plan should not look different from county to county. It should not look different from facility to facility. The template should be standardized, and what you put in it is the person-centered part. So it really maintaining that balance between person-centered and that standardized way of approaching assessment and planning. I think it's important to call out that we wanted a work group representing all stakeholders in the system was developed, and they developed the template, and then it was tested and kind of, does this work? What feedback do we get? And that it really was meant to look at things a different way, to come at things from a different perspective, to ask some global questions, to balance what we already know about someone. How do we get to know them a little bit differently? And then dive a little deeper into not just what the person wants and needs, how they want that to be delivered, and who will be responsible to clarify those things. So really the key points were simplify, standardize, and that portability piece.
Thank you very much for the overview, Beth, as well as the updates. I appreciate it. It's very helpful. Do we have any questions for folks about the Ohio ISP? Any questions for Beth?
Hi, Beth. It's Kim Matthews at the Ohio Department of Health.
Hello.
Hey, I just had a really quick question. I had a guardian reach out to me for an adult individual in Franklin County. And the guardian had asked about the Ohio ISP, is very excited about it because obviously it's going to make life a whole lot easier for everyone. And Franklin County mentioned that they didn't know much or anything about it. And so I was wondering if there's a way to help them maybe learn so they could be able to begin implementing that sooner rather than later. And so I just thought I would drop that as a question, a respectful question.
Thank you. I appreciate that. And I think it's interesting. We'll follow up definitely because we have been working with Franklin County for quite a while now, over a year, and they have lots of plans. They've utilized the Ohio ISP, and they are using one of those outside vendors I mentioned. So it's about transmitting plans. So they have been utilizing the new template process approach for quite a while. So we will certainly follow up on that, and I would be happy to follow up. I can include my email information, and you can send me any details that I would be happy to follow up on.
Would you be okay with me sharing your contact info with the Guardian?
Absolutely.
Thank you, Beth. I appreciate that very much.
Thank you so much.
I think we have another question from Krista, I believe.
Yeah, I just want to make sure, because I feel very confused when she says ISP. Like for my child, ISP stands for Individual Service Plan. So is the ISP something, Ohio ISP, is it something different than the Individual Service Plan, or is it just like adding the Ohio to it, modifies it and makes it better? Like, I'm just wanting to clear in my brain that we're talking about an Individual Service Plan and not something different.
Okay, and that's a really good question. It's basically the ISP that people were using, and I was talking about there's lots of different versions of that. People are doing different versions of that through their template that they're using locally. And now there is a standardized. The Ohio ISP is what that work group developed. So that is what is required by June 30th of 2024 for people to transition to that standardized template. And it's also includes that that process. So for assessment and planning. So it is I can make available the link to the online version. It's on our website. So that is what people will be using by 2024, that it's that standardized template. So it's a very good question. What you're currently familiar with, the individual service plan, this is just now that standardized required template that people use throughout the state. Does that help answer your question?
Yes, and I want to, with the other lady, I'm also in Franklin County, and I agree that there is a lot of misconception here on things, such as like when I reach out to my SSA, she's unaware of something that I've learned in this group or somewhere else, because I've been educating myself a lot since the summer, because my daughter had a brain surgery. So education helps me, and then I present something to her that I've learned, and she's like, no, that's not true. And I'm like, I believe it's really true. So we go back and forth a lot, and then the supervisor gets involved, and typically I'm right, like not to downgrade anyone, but so I do agree with that lady that there's probably a lot of us here in Franklin County that is misunderstood on things, because I don't think there's enough information available.
Okay, and I hear you, and we will continue to work with them. I will reach out to see what we can possibly do, myself and my team, to see what we could do, if there are any joint meetings, if there's anything we can provide, some standardized information that would be helpful. So we will certainly work with that to kind of fill that gap. Thank you.
We have a couple of things in the chat here real quick before we move on. One of the questions is, will this change how the ISP is shared? Will everyone who needs access to it be able to log online and see the ISP?
Yes, everyone will be able to log in and see it. If they want access, you can also request a printed plan. So nothing will really change with that. What we hope the enhancement is that you can have access in real time. Everyone, regardless, I know it's a little confusing when I said that, people can enter directly into Salesforce, or they can use that vendor to transmit information. Team members will have access to Salesforce. Anyone can view anything they need to in the Salesforce system. no matter if the county is using like a Brickco or Primary Solutions as that outside vendor. Everything will be available to those team members in Salesforce. We have standardized kind of walkthrough guidelines of how to access that and how to utilize that system. So yes, you will be able to access that information.
Can I give you some Beth some positive input on this and listening to
Absolutely.
the other parents? My son's service coordinator knows all about this, that has implemented it, and just listening to people, I think it comes down to be very blunt about it, the individual service coordinator, and has the county, because Franklin County is so large, had the time to get to every service coordinator to retrain them. And I think one of the reasons that we were fortunate enough to have a service coordinator who knew about this is he was coming in new as a service coordinator. So his training just inherently included this, and he didn't have to be retrained. One of the things that I was very impressed and relieved about as a parent, because I was a birth parent for decades. Our son passed away, our birth son passed away in 2005. I'm very well known within the volunteer work, in the field related as an advocate, et cetera. Now this is our special needs adopted son. We were his foster parents. So I've been doing this for a long time, the point being. And one of the biggest changes that I was impressed about and relieved about was you didn't start out with, what are you, the parent, doing to take care of your child? Because that has always been so heartbreaking and so offensive. It's like, no, it's not typical that I should be diapering somebody who's 10 years old, but now you want to know how many hours out of the week I do that? It was brutal, absolutely brutal, emotionally to parents. And I think it put parents I never did, but I think it put parents in a position to actually falsify information sometimes just so they could get the help that they needed. So I just want to share with you that our service coordinator is very aware of it and is very proactive in maintaining that. We had our 90-day, and this one we did Zoom just last week, and he is very aware. So I think from the county standpoint, pull people in. I know everybody's busy, but how the real focus is, how are you going to give the service coordinators the time to get them retrained is maybe the real issue.
Yeah, I appreciate that feedback so much. It's great to hear. We need to hear the good, the bad, and the ugly with this. So it's good to hear the positives and where we need to focus some attention. So I do know that there's a lot of work to be done, and I'm glad that it sounds like newer people, this is just part of what they do. It's probably harder to break old habits, old patterns. We've been doing it one way for a long time. I think it might be helpful to useful to share that we are approaching some of those larger counties. It is a big ship, and we hear that a lot, that it is, hard to get everyone on the same page, but we're trying to break it down to those individual teams, because those layers of supervisors and those actual service coordinators should be around the typical size throughout the state. So whether it's a smaller county or a larger county, it really should break down to those individual teams, and making sure that we have standardized kind of questions, maybe that would raise some of those red flags, and really get in there and see what people are struggling with. What is the hardest for them to change? What information are they hearing? And kind of dispel some of those myths, I think, is so important, because I think sometimes things kind of spread. Somebody hears something wrong and then they communicate it, or they're just trying to get done. Like you said, it comes down to time. So we're really trying to, as we push forward with the Ohio ISP, really look at those core functions of that SSA and that QIDP too, to really focus on that, and to provide some of that as technical assistance and training.
Well, thank you for receiving that input, and I'm glad I could share a positive.
Thank you so much.
We were fortunate to have that to share. So
thank you, Wanda. Thank you very much, Beth. I do want to move on. We have quite a few other people who have some updates to give, but one last question is, are there going to be trainings for families on the Ohio ISP? If you could elaborate on that a little bit, maybe.
Yes, we are developing that. We're also developing trainings. We're gathering feedback. Thank you, Meredith. You add the frequently asked questions from the website. And we are also trying to get videos. We know that people's time is valuable and that we want to do like quick snippets. Like if there are highlights, if there are people who want like a quick update, down and dirty update and of just the changes, we want to provide that as well. So we're looking at some creative ways to get information out. And then, as always, they can go to a link on the website to find further information if they want to get a little more. Thank you.
Thanks, Beth. I appreciate it. We do have a couple of other questions in the chat. If you're able to peek at those and provide a response, that
Sure.
would be great. I
Will
appreciate
do.
it.
Thanks.
Thank you so much. Next, I'm happy to turn it over to Nyoka from our Medicaid and Development and Administration team. I know she was having some technical issues. Are you able to join us, Nyoka? We are not able to hear you. I don't know if you can hear us.
Hi, can you hear me?
We can. Thank you.
Okay, great.
You've gone muted. Can you unmute?
Okay, says I'm unmuted again.
There you are. Thank you. You've gone muted again.
Okay, this is really strange. It keeps muting me. Can
We
you
can
hear
hear
me?
you now. We can, yeah.
I don't know what's happening today. Having all kinds of technology problems. Okay, well, thank you all for having me. I do apologize that I'm not able to be there on screen. So just a couple of things I wanted to touch base on. One is I just wanted to remind everyone about the Appendix K, public health emergency dates. Those went out in the memo Monday quite some time ago. I can send those back out to Corey again. But as it stands right now, unless we receive another extension, which there is some belief that we may, the public health emergency, federal public health emergency is scheduled to end January 11th. Therefore, the unwinding would end July 10th. We do continue to work on those unwinding activities.
So Naoka, you've been muted again. If you could unmute, that would be helpful.
Why is it doing that?
I'm not sure. It's muting me as well.
That's so strange. Okay. I'm just going to move on. The other topic that I wanted to talk about is our self-direction work. So we continue to really promote our self-direction work in all of our waivers with GT Independence. And I do meet with them every week, and we're really trying to keep that relationship good and strong and get that work implemented. It has been a bit of a struggle just getting them in quickly. And so it certainly hasn't all been a smooth ride. Sarah Davies Milliman has recently been added to their team. She is from the Lucas County area. She has been a provider. And so she has really agreed to be the contact for families in particular who are struggling or having any issues. So again, I intended to be there where I could enter this into the chat. So I will get that information to Corey so that everyone has her name, her email, her phone number. And please share any concerns you have with Sarah, share them with me. We can have those conversations and work through those issues. They have been so far very quick to respond when we bring issues to them. So I really want to make sure that we're hearing when people have problems and people aren't struggling for long periods of time with issues. So, Corey, I will get that information to you as soon as I can this afternoon.
That sounds great. Thank you. I'll make sure I distribute it with our other resources and links and information.
Okay. And I apologize for all the difficulties. I don't know what's going on.
Do you have any other updates, Naoka?
No, I think those are the biggest ones I wanted to share.
Okay.
And it certainly, if people have questions or concerns about GT independence or self-direction in general, please feel free to reach out to me and to Sarah once I get you the information.
Okay. We do have a comment that GT independence has been very hard to work with. I've had our county contact supervisor several times. They threatened to freeze my son's services because I sent in his birth certificate in July to the intake person, and that department won't send to the other. So they said I had a deadline to resend or be cut off. The supervisor confirmed both departments had the information, and she didn't know why they were threatening families, is one of the comments we have here, Naoka.
Yes, that should not be happening. So let me, I meet with them this afternoon. Let me follow up
Okay.
on that. I'll see that in the chat as soon as I can get logged back onto my computer this afternoon.
Okay.
So
Thank you. And then we have another question here. Can you please explain the impact of the unwinding we'll have specifically?
The unwinding is where we are determining which services, which flexibilities we keep or modify. So for us right now, the primary ones that we heard when we surveyed some time ago, that families and providers and county boards let us know that they had strong feelings about were parents of minor children, HPC and shared living on the same day. We had some feedback on residential respite, not very much at all on like onboarding. There were some flexibilities about onboarding staff. So really, we have to look at the impact. First off, it's what is available or even possible to keep, and then the impact to families and the system in keeping those. So, I don't know if I answered the question.
Thank you, Naoka. I appreciate it.
Sure.
Any questions or comments for Naoka and the Medicaid team here at the department? Naoka, I really appreciate you being here and for the updates and the information. Thank you very, very much.
Sure, I will get that information to you, Corey. And Sarah is also willing to come and talk at this group or either of your family groups at any time, Sarah from GT Independence, if that would be helpful.
Okay. And Amy Clausen has added some contact information into the chat as well here for everybody. Thank you, Amy.
Yes, I did. I did send that to Amy earlier, so she has it. Yeah.
Perfect. Thanks again, Naoka.
Sure, thank you.
Appreciate it. So in a previous Family Advisory Council, there was an ask that we have our colleagues from Ohio Rise attend and provide updates and answer any questions. And I'm really excited to introduce Kelly Smith, who has joined us here from Ohio Rise for an update of what's happening in that space. Welcome, Kelly.
Hi, Corey. Hi, everyone. Thanks for having me. And I'm also joined by my colleague, Autumn Darnell. Autumn, do you want to introduce yourself?
Sure. I'm Autumn Darnell, and I'm the section chief with the policy and program development with the Ohio Rise team.
All right, I'm going to go ahead and get started. So we were here at a previous meeting, and we talked about the Ohio Rise program, gave like an overview, but this time I'm just going to give some updates. So this is a new program that launched July 1st, so we're in the implementation phase of it, and it's really for kids and youth up to through the age of 20. who have complex behavioral health needs, and they're part of multiple systems. And so these kids can have co-occurring disorders and might be involved in the disability system, developmental disability system. So I'm going to go ahead and get started. This is a few metrics from our first 5 months since the launch of the program. CANS assessors and CANS assessments are really a doorway or a front door into getting into the program. So a youth who might be identified that might benefit from Ohio Rise and get certain services and care coordination would have to get a CANS assessment in order to be determined eligible for the program. And so we are trying to grow our CANS assessors across the state, and we're encouraging anyone and everyone. You don't have to have a clinical background to become a CANS assessor. And so we have over 2,000 CANS assessors today. They have submitted over 15,000 CANS assessments into the system, and that has enrolled 13, almost 14,000 youth that we have into the program. One of my main roles at Ohio Rise at the Department of Medicaid is to meet with people just like yourselves and spread more awareness about Ohio Rise and try to get families and youth to know about the services and supports that are offered through the program, as well as community partners. So our SSAs that are developmental disability boards, our caseworkers, the child protection system, folks in the juvenile justice space, all kinds of community partners to understand how Ohio Rise can benefit youth that they serve. And so you can see a number of like developmental disability boards, for example, courts, different folks that we have met with. And not only are they public service entities and associations, they're also consumer and advocacy organizations, as well as providers and associations. So if you think of any that we should be in front of, please reach out, let me know. This month, we're meeting with, in the education system space, a couple of different associations. In the developmental disabilities system, we met with the Highland County Developmental Disability Board, providers, an advocacy organization. And then on the right-hand side, those are some of the groups that we've been reaching out to get in front of them. Some of them we've met with, had an introductory meeting, and then we've asked, can we get in front of your memberships and your networks? And we've already have some meetings scheduled in the new year. I wanted to just point this out really quick. So in the new year, we are planning to target different community child serving entities or systems. I'm sorry, systems. So for the first one that we're targeting is the child protection system. And we have what's known in Ohio Rise as care management entities. So we've created 20 new care management entities. It's kind of like a new layer into the system of care across the state of Ohio. They cover different catchment areas. So they cover many different counties, or in our metropolitan areas, they might cover half of a county. Like in Franklin County, there's 2 care management entities. And their main role is to provide care coordination. So they've hired care coordinators. And this is what's really the heart of making sure that multi-system youth and their families don't have to navigate across systems. So if they have a developmental disability need and they're involved with their board, or they have a child protection worker at their public child service agency, or they have a behavioral health provider, instead of that family having to meet with each one of them and get different mandates that are said to them, like you have to do this, you have to do that, different caseworkers telling them to do different things, and then the caseworkers aren't really talking to each other. These new care management entities and their care coordinators bridge those gaps and actually bridge between all of the different systems. And so that's the main role of what care management entities do. Well, this is a brand new program. We're just now implementing Ohio Rise. And this is a lot of work, and it's going to take time to have the different child serving entities at the local level and at the county level start to talk to each other and understand each other's roles and responsibilities and requirements and how they serve families, and how then to work together and bring it all together. So the first group that we're targeting is for our child protection system to really get engaged with the care management entities. So We're starting a workshop series in January, and the first breakout room session, they'll be virtual to bring all 88 child serving agencies together with all of the care management entities and have a virtual breakout room where we talk about roles and responsibilities. And then we move on to, we serve the same kids. We have a case open and you're serving that same youth. How do we work together on those kids? And then what we want to do is we'll learn from that experience. Things might change, but we want to do the same thing with the DD system and the court system and so on and so forth. So I just wanted to mention to you that that kind of work is going on in the Ohio Rice space to really try to get out into the local communities and help bridge that gap between Ohio Rise, the program and what it's doing, and systems that already work with children and how they can better serve the kids that they're working together on because they're serving the same kids. I wanted to share one success story. We get a lot of these. We know that Ohio Rise is still again being implemented, but we do receive success stories about how Ohio Rise is impacting the youth that they're serving. And so in this specific story, the child was already enrolled in Ohio Rise, and they were living in a foster home, and they were attending a school for youth with behavioral health challenges. And they were actually in jeopardy of receiving a 30-day notice to vacate their foster home due to increasingly violent and disruptive behavior at home and at school. They were enrolled in Tier 1. Now, this is a care coordination by the Ohio Rise Plan at Aetna. And when that Tier 1 care coordinator at Aetna had heard about what's going on with the youth, they worked with the child protection worker in the child protection system and got them the youth evaluated for developmental disability services. And they updated that CANS assessment that does ongoing care planning. The CANS assessment did say that that child required a higher level of care coordination, so no longer Tier 1, but now Tier 2. This gave that child access to their care management entity, because care management entities provide care coordination Tier 2 and Tier 3 for more moderate and intensive needs of a youth. And that's determined by the CANS assessment. And so that care coordinator at the care management entity put together a child and family team. So anybody that's involved in that youth's life. So again, probably the child protection worker, now the DD system, and the youth and the foster parent, and started to talk with them about, okay, what does this child need? And what are the Ohio Rise services and supports that we can offer? So they connected that youth to behavioral health respite and intensive home-based treatment. So after that teaming process came together, where we're helping that youth and family navigate across all the systems that they're involved with, the needs were identified, plans were made, one coordinated plan, and then the youth's foster parent actually felt really relieved and excited to have that team around them, wrapping services and supports around them. And now that foster parent feels comfortable and willing to continue to foster that child. So we're really excited to hear stories like that. And I'm happy to share that with you. So just to wrap things up, how does Ohio Rise support youth involved in multiple systems? After the launch, now there's new and enhanced services that are offered through Ohio Rise and are now Medicaid billable, such as care coordination, intensive home-based treatment, mobile response stabilization service, behavioral health respite, and flexible funds that follow a child. It's $1,500 a year. And then care coordination, and that's that again, what I was just talking about and describing, making sure that this is consistent across the state so that no matter where a child lives, they're able to access that kind of care coordination. And then we're really, the program is really aiming towards keeping families together and supported in their community instead of going into placements. And so all of the Ohio Rise services and supports are really they're really community based, and they're about helping to keep families together. And then really over time, growing and building that system of care for youth and families through the care management entities and as well as our state sister agencies and partners at Aetna. You can help Ohio families by, we have a brochure that you can utilize. It's on our website, but it's right here linked. We have a flyer that describes what Ohio Rise is. The CANS assessment's really important. So trying to get, if you think a youth could benefit from Ohio Rise, making sure that they know about the CANS assessment, getting those scheduled. You can become a CANS assessor and provide CANS assessments, and you can even bill Medicaid if you are a provider. That child and family teaming process that I just mentioned briefly with the care management entities, you can be a part of that when asked. You can also leverage the child and family team process if you think this is really important, if that I take part in this child's teaming process and I talk to them about what services this youth needs and making sure that that gets on their child and family centered care plan. And then really engaging with those care management entities is really important. They're trying to build a system of care. They understand that relationship building is really important. And I think reaching out to your care management entity is really a value add for even the work that you all probably do. And on our website, you can find the contact information for care management entities. And I'm happy to talk to anybody at any time about the program and give more details. I know this was supposed to be a really quick update today. So thanks for the time. And please let me know if you have questions.
Yeah, thank you, Kelly. We really appreciate the updates. We do have a hand raise in our group here. The name comes under as board chair. I wasn't sure if you wanted to unmute and share your question with us.
Sure. I couldn't get the name to change, Corey. It's my Greenleaf Microsoft thing. I wanted to also give a positive back for Ohio Rise. I'm a parent mentor in Dublin City Schools, and I have a family that we have been working with 3 years for a child that's in an out of placement situation. And it's been a situation where the child has had to live away from home few hours, right, to have the appropriate treatment that the child needs. It has been an uphill battle for all of those years to get different agencies to fund different things, right? Because everybody was like, well, that's so-and-so's responsibility, that's so-and-so's responsibility. And meanwhile, we're like, well, we need to help this kid. We ultimately got funding that we needed to keep this kid safe and everything else. But with Ohio Rise, Mom and I have been very active in that. The big difference that we have seen is, first and foremost, we're not having to do the fight for the funding anymore. We're not having to contact all the people going up the street, the chain of command to fight for the funding. That care coordinator is doing that for us. Now, granted, we already had a pretty good team that we had developed, so that made it a little easier, but there were some outside funding things that we wanted. We wanted Mom to be trained on some of the things that the staff were trained on. So that way, ultimately, we can bring this girl back home, but we can't bring her home if the family is not appropriately trained as well. We also, even though she's still in placement, we wanted the placement to be closer to home. So that way there could be weekend visits, there could be evening visits and things like that. And so through Ohio Rise, we were able to fund a closer location so that this child can come back and be part of our school system again, as well as, have regular visits with family. So I will say it has made an impact. I mean, there's still a learning process, definitely, for everybody involved in the meeting. And I will tell you, there's probably, because I coordinate the meetings, there's probably 18 to 20 different people that I invite to these meetings. So we're talking lots of agencies involved and lots of moving pieces, but having that care coordinator that we can just say, we need funding for X, or we need to know a move-in day for this or whatever. And then that's now on her rather than on Mom and me. It allows Mom to step back and just be Mom and help the daughter through this transition. And that has been truly a blessing. So I just wanted to share something positive.
I really appreciate that. And if it's okay with you, I would really like to reach out to you, and we feature those kinds of stories like the one that I shared, because we get them and then I include them in We have a launch report that comes out bi-weekly so that we can share. It's the way that Ohio Rise is going to be successful is if we can show community partners the benefit and show families the benefit by sharing these kinds of stories widely. So if I can reach out to you after this, I would love to do that. If you'd put your email in the chat box.
Sure, I will. And then, the other thing too is what I'm hearing from other families though is a lot of times the care coordinators were so quickly trained, right? That they don't know all the details. And so the benefit for our care coordinator was the fact that our team was already very functioning because we had to be. And so, ensuring that the care coordinators are getting ongoing training about this because she still has had to every once in a while go, I'm not quite sure about that. Let me check into that and I'll get back to you. Right. And I can tell you the parent in the beginning was very concerned about that because parents want to know what you're doing and you're going to get me the help that I need. And so gray answers don't really go over very well, but now we're doing much better. You know what I mean? But it took a while. The care coordinator has been involved in our team since end of August, so it's rather new, obviously. But each week, because we meet weekly for this kid, all the agencies involved. And each week you just see her skill set and her strength coming through more, right? She's learning more. So I do think, the training component, and as more people become aware of it, and more people become aware of what that flexible funding can be used for, is really powerful. Because I'll tell you, and I don't think I'm surprising anybody on this meeting, when it comes down to it, there's two things that hold everything back. Appropriate placements, because we don't have enough appropriate placement options, and funding, right? And so the Ohio Rise piece has allowed other people to step up and provide funding, whereas before it may have been an argument. So that has been a blessing. But yeah, I'll put my email in the chat, and thank you for letting me share.
Thank you for sharing. Appreciate it.
Thank you, Dee, for sharing, and thank you, Kelly, for the updates. We appreciate it. Thanks for joining us today. We're going to move on in our agenda here, and I'm excited to introduce Roya, who is going to share a little bit about the summer employment program, summer work program from OOD. Welcome, Roya.
Thank you, everybody. Hi, everyone. My name is Roya Hood. I am a program specialist in the Supported Employment and Transition Unit with OOD. I got a slight slideshow. I'm going to talk a little bit about transition services with OOD. So I'm going to touch base on a little bit more than just summer youth, just to get my plug in there. And give me just 2 seconds to pull it up. And can you see it? Okay, cool. So at OOD, or at Opportunities for Ohioans with Disabilities, we define transition students with a disability. They're going to be ages 14 to not yet 22. They're going to be our students who have identified they are currently in school, and that would also include anyone in post-secondary training. They have a known or suspected disability, whether that be a learning disability, mental health, mobility, hearing, and/or vision. So that's kind of how we identify our transition youth or our students with disabilities versus our adults or caseloads. And as far as how we look at what transition services are, just a coordinated set of outcome-oriented activities for a student that promote the shift or transition from school to work for post-school outcomes. So with OOD, we have several different services that we provide. We have some that are just specific to our transition youth, meaning that these services are specifically designed for our youth and are not necessarily available to anyone who is an adult. So things that are individualized for our transition youth may be any developmental activities. We have pre-employment transition services or pre-ETs. We have summer youth work experience. We also have job development and their placement, which includes most of our non-permanent job development, which is for seasonal or maybe after school job. We have on-the-job supports that also include supports for a non-permanent job and school-based readiness training. So this is kind of an overview, of course, of all the services, again, that are just specifically designed for our transition youth. So we talk about individualized services. So with OOD, we write what's called an IPE, which is a plan for employment. So we use this to identify what our vocational goal is and what services we're going to provide. And these are the ones that sometimes when we're working with transition youth that we identify our services that may be needed at the time to reach that goal. Tell me if I'm talking too fast too. Sometimes I do that. I'm on a roll. So the first one uh-oh, I see a hand already. Go ahead. Go ahead, Wanda.
I'm sorry, wait till the end. There was a pause, so I thought that completed your presentation, but I will wait. Thank you.
Okay, no problem. So the first service I want to talk about is pre-ETS. These are just our pre-employment transition services. These are what we call our Fab Five. So these are just pre-introductory services designed for students. They are not highly individualized. They are actually coordinated with schools. And so a lot of these services will happen while students are in school, sometimes during breaks, sometimes after school. We coordinate with our CRPs or community rehab providers to provide these services directly with these students. Again, typically they are provided in groups. They are 14 to not yet 22 students who have a documented disability currently enrolled in school and who can also benefit from our services as well. This is just, on the screen is just a picture of our pre-ETS flyer. We allow our providers to use this, so anyone who is a provider who provides these pre-employment transition services can use this flyer to kind of promote pre-ETS services, and they are available throughout the state of Ohio. Wanda, did you still have a question, or is that just for me when I'm done? Okay, cool. When we talk about who can receive our pre-employment transition services, they're going to be our students ages 14 to not yet 22, students with a documented disability, students that are currently enrolled in school. So the difference between our pre-ETS, we call it our princess or our unicorn for particular, because it is the one service that we provide within our agency that can be provided to students who currently have an open case with OOD and for students who are considered to be potentially eligible. And so that is different because you don't have to have an open case. You don't have to have an eligibility decision. Typically, we look at like our 14 or 15-year-olds. It is not just designed for them, but it is available to maybe a student who maybe they're already linked with their county board. Maybe they got other things going on and they're not ready for the full gamut of VR services. They can come in what we call our potentially eligible door, and those referrals will come directly from the school. They are not assigned a counselor. We have our caseload career resource caseload assistants who kind of oversee the referral from the school to the provider to coordinate those services. Again, and those students are only available for potentially eligible, only able to benefit from those 5 services. However, if they ever want to open a case for services, they absolutely can. And this slide just really much kind of touches base on those potentially eligible students. Again, if you don't want to have a full open case, those direct requests come from the school. And then when they send the request, there's documentation for documentation is sent along. So again, you come in 2 different ways with our pre-employment transition services. It doesn't mean you have to go this way or another, but it's just another option for students to kind of get linked with services. Again, these ones are just specifically designed for our students 14 to not yet 22. So it can include students who are in college who have not aged out as long as they are currently still enrolled. Another one of our transition services that are specifically designed for our youth is our summer youth work experience. So with our summer youth work experience, it is a service intended to help students obtain competitive employment skills. So what it does is in the summer, we have our summer youth work experiences that are located throughout the state. We work with different providers who will provide work experiences that are let me see, I say boots on the ground. So it is for about 5 weeks in the summer. Students are paid for that experience at minimum wage. So there's a wage add-on for that. And so we just recently changed kind of how we deliver it. It is for 5 weeks, but there is an option for maybe a student who 5 weeks may be too intensive or doesn't maybe have the ability to participate in all 5 weeks. Next year, we were going into levels. And so we'll have a level 1 summer youth work experience where it has about 10 to 12 hours per week, structured about 2 to 5 weeks. And then we'll also have level 2 for those students who maybe they've already completed level 1, or maybe their students a little bit more advanced who can do the 18 to 20 hours a week for 5 weeks. So like I said, we just changed that. It is still everyone still has the same opportunity to participate in all 5 weeks. We just want to give some options for those who maybe could not do a full 5 weeks, who might have been missing out on the experience, have a chance to engage in summer youth and still get paid for that. So again, we run this service every year. It is in every county. So it does go by availability. We do have slots at different employers out. And then every year the providers try to add onto that list. So again, that's throughout the state. I did see a question that says individuals who are 20 or 21 but have graduated from high school eligible or not. So that's for pre-ed. So if they are 20 or 21 and they have exited with their signed diploma, they are no longer considered enrolled in school. Although they can still benefit from any of our other services, they just cannot participate in pre-eds. So that's the difference. So they would still, we wouldn't close their case if it's open, or if they were potentially eligible at that point. If they've exited, they would need to actually apply for services. That is the biggest difference. And that comes from RSA. We have like parameters that biggest thing is that they're 14 and not yet 22, and they have to be enrolled in school. That does include students that are homeschooled. So if they're being currently homeschooled, they can still participate. The parent at that point would just sign off on that documentation. But again, so our summer youth is for our students who are on an open caseload, have been determined eligible. They do have an IPE or individualized plan written. If they have an identified goal and they've identified maybe a summer youth work experience that's for it. And we've been doing this for years. Again, we grow sites every year. What happens is that our counselors will go out in the summer to also visit these students while they're on site and working. It's a good introductory service for students who haven't had any work experience before, to kind of get that pre-work experience before they go into what we consider competitive and integrated employment on their own. Kind of get an idea of what working looks like, being on a schedule, how to manage time, and things like that. There's a skills to pay the bills component that is for part of our summer youth work experience. And so where they learn some of those basic skills about timekeeping, managing breaks, and things like that. So that is also built into our summer youth work experience. Is there a flyer? There's not necessarily a flyer about summer youth work experience because we don't advertise just that service. We do have plenty of other transition resources that I can share with you that kind of gives a breakdown. So what you're seeing on your screen is actually just a screenshot from our transition services document. And what I can do is I can share that document with you guys in the chat, and it talks about all these services we're going to cover. So hopefully that can kind of help you understand how that works, because we don't have like a list of, every year that list may change. And so that list is published to our counselors, who then talk about to the students about what the options are available to them in their area. But that's a good question. Maybe I'll tell them to get on that. We also have something called non-permanent job development. What we were finding is that there were lots of students who maybe wanted to do an after-school job or maybe a seasonal job, and they wanted help from us. And so before, we would always talk about that competitive integrated employment and making sure we're not closing students before they've exited high school. And so maybe they need help doing some things in between there, because any experience is going to be good for their final goal. So our non-permanent job development is for students, just again, those seasonal jobs, after-school jobs, we don't count it as their permanent employment goal, or we don't necessarily close your cases on non-permanent job. It is just what it means. It's non-permanent, it's seasonal, it's not intended to last, it's not intended to be their final goal. And it can happen initially anytime during the year. So maybe there's a student who's done summer youth, they did a good job, Maybe in the fall, they want to look at getting an after-school job. They want to continue that work experience, or maybe it's Christmas time. They want to earn a little bit of money. We can also help with them getting that non-permanent job. And the students are going to be paid, of course, according to the employer, because they are actually being hired in the outside world. And we do have on-the-job supports or job coaching for those non-permanent positions, so we can help those students keep those jobs. Other services that, all our services, this is kind of out of order. Let me come back to that one. Oh, I skipped it. There it is. One other service that we have that is specific to our transition youth is going to be YLF, which is our Youth Leadership Forum. It is designed for our high school juniors and seniors. I believe this year we're getting ready to start looking at accepting sophomores as well. It is around advocacy and leadership. We have 5 forums that are located throughout the state. We have one statewide, one is virtual. You do have to be eligible for OOD services to participate, and we take applications in the spring. It's a super cool thing. It is strictly led by people who were previously in the program. So some of the ambassadors for YLF are the people who previously have completed YLF. So they become like the trainers and the mentors for the program. The governor usually comes out and speaks. So it's a pretty great program. So if you have a student who's expressed interest in advocacy or leadership positions, we highly encourage, if they're already linked with OOD, or even if they're not, to make sure they get linked to kind of talk about if YLF would be a good service that is available for them. We also have this information is all on our public facing website on ood.ohio.gov. If you go under individuals with disabilities, there is a students 14+ tab. And under that, we'll have all the information that I talked about today. And it gives information about any of our transition services, how to refer a student. Their application can be accessed on there. Any of our flyers and marketing material, information about pre-employment transition services is also available on our website. We additionally have this Connecting Students with Work flyer. This is a good way we kind of share this information with people about getting people, once your students start having conversations about wanting to go to work, how to get connected with services. We are in all 88 counties. And so we have main offices, and then we have people who kind of travel out to those. And so we use this as a way to get people to know about OOD and how to get them in the door to us as well. The flyer is available on our website. We can get it from you can also request it from our communications page as well. We also have a "Are you in high school?" flyer or postcard. So this is a flyer that we do have that says, "Hey, are you in high school? Are you interested in working, making money?" Has a nice little QR code you can scan. So it shows you how to get linked and kind of talks about how to get linked with and kind of get a better way to get connected with services with OOD. And with that I gave you the short and very, very short and very sweet version of what our specific services are for our transition youth. My name is Roya Hood. Again, my supervisor is Julie Hance, and we're in the Support and Employment and Transition Unit. You can feel free to reach out to us at any point if you have questions. And I think, Wanda, did you have a question now?
For the sake of time, would it be okay if I connected you two together to chat with one another?
That's
Just
fine.
so we can move on. We're short on time at the moment. Would that be okay, Wanda? You're muted. Would that be okay? Wanda, I hear you talking, but I think you're muted.
I wrote down your email address, so I'll just send you my question.
Okay, that works.
Thank you.
Very much. Roya, thank you very much for those updates. I really appreciate you and the work that you're doing at OOD and the services that you've shared with us today. Thank you.
Thank you. Thank you guys so much.
Next, we're going to have an update from Paul from DD Council. Let's share a little bit about DD Awareness Day coming up in March. Welcome, Paul. How are you?
I'm good. Good afternoon. And I do not have a big fancy PowerPoint, and I'll try to keep this short and sweet. My name is Paul Jarvis. I work for the Ohio Developmental Disabilities Council. I am here to talk about our DD Awareness and Advocacy Day. It's coming up on March 1st of 2023 at the Ohio State House. The DD Council has supported a legislative event of some sort since 2006. That's as long as I've been involved with the program. And for the bulk of our programs over the past 15, 16 years, we have focused on the perspectives and needs of adults with developmental disabilities, and kind of left the families of young children out of the focus of the day. And so that's an error that we're trying to correct. And so moving forward, I think we've included on the agenda this coming March childcare for families with children with disabilities as one of our focus areas for people to talk to their legislators about. We're going to see some additional funding. We just saw some additional funding in an omnibus amendment last night for childcare, publicly funded childcare, about 500 million additional dollars for that. So we're hoping that families with children with DD can tap into some of that funding, and we want folks to have access to it. Historically, I was just looking at our numbers over the past 5 years. We do not have a lot of family members participate in this event at the Ohio State House. It has significant participation from adults with developmental disabilities, and what typically happens is, a county board will put some folks in a bus and send them to Columbus, or a provider will put some folks in a bus and send them to Columbus. Last year we had 18 family members out of over 300 people in the room at the State House. And so, we wanted to talk to the Family Advisory Council and get the word out that, hey, we need families to be involved in this process too. Your voices are just as important as adults with developmental disabilities, and you have different perspectives to offer. Other topics that we'll be talking about in March are the DSP workforce crisis, which I'm sure many of you have heard about or are dealing with when you're trying to provide or find support for your loved one. And self-determination and supported decision-making. There has been some discussions around individuals being able to make choices on where they live and what they do with their time. And so we want to just reinforce, at least from a council perspective and from a community perspective, that there is self-determination and there is supported decision-making for individuals with DD, along with the child care topic. We expect registration to open in mid or late January. I did have my grantee was here. She had to leave. She could have filled you in a little bit more on the event. The event typically starts at 10 o'clock in the State House atrium. Registration does typically fill up quickly. I'm going to post in the chat the Facebook page where you can follow, and we make announcements on when registration opens. But I just want to encourage families, our target is a minimum of 50 family members come and participate in this. And we have, outside of 2021, where it was a virtual event only, we had 73 virtual family members that, zoomed in and watched the program. We haven't hit that 50 target in the last 50 years or last 5 years. How do we prepare families in their participation? That's a great question. We try to have a fact sheet available to families. And typically, in the last few years, we have avoided from telling people, talk about this bill or talk about this. We actually want people to talk about what's important to them. And so, if I told you, handicap parking is the biggest issue, well, it may be the biggest issue for, half the people, but the other half of the folks that are attending, it might not be their issue. So, I encourage people to go to, come to the event, meet with their legislator, and just establish a relationship and a connection. Tell your story. That's more valuable than anything that I will ever do when I do my public policy work. Is you establishing a relationship with your legislator and becoming a resource for him or her when the time comes for them to work on a bill. It's better for them to call you than it is for me, because I'm not a family member. I don't have that lived experience like families do. And so that's why we want to encourage your attendance, your participation. You got to be in the room. You got to be there making those relationships. That's a great question. It's something that we're working on to ensure that, everyone does have access. I can tell you that we typically try to cut registration off at about 400. And what happens is, we hit the cap and then people come in afterwards, can I be added? What I would say is if you're in one of those categories where we're not meeting, I would say, yes, we'll add you. We won't put you on a waiting list. But if you're if you're the 100th person from one Senate district, that we have 99 other people that are represented by your, category, we'll probably say, hey, can we put you on a waiting list and make room for someone that isn't represented at our thing? So that's it. That's as short and sweet as I could make it.
Paul, thank you very much for those updates and the information. We're looking forward to DD Awareness Day in 2023. I am going to share my screen here and provide some really quick updates from our team here within the Division of Policy and Strategic Direction with our Family Outreach and Education teams. As I shared last time, we are excited to have Meredith Mendoza, who has joined our team, and she is our Family Outreach and Education Coordinator. Meredith is coordinating all of our Family Advisory Councils for 2023, and we'll have that information out to you shortly. We are looking forward to our continued conversation with the Family Advisory Councils. And Meredith's doing a lot of family outreach and education work throughout the department with other partners, and we're delighted to have her with us and excited about the work she's doing with us. In addition to that, we've also added another team member to our team. We are super excited to invite or have Nate Turner, who has joined us as a advocate policy specialist here at the department. His role mirrors Meredith's in terms of supporting individuals with lived experience. We're excited to have him engaged in our work and having conversation with partners and looking at ways that we can provide greater support and information and resources to the individuals we serve here within the department. I'll also share that we are looking forward to our Ohio showcase for the Charting the Life course work that we're doing here in Ohio. We have Dr. Carrie Magro, who is coming from New Jersey. He's a person with autism who will be our keynote speaker. And then we are going to have an array of things showcasing things that are happening in terms of supporting and empowering people in Ohio with this Charting the Life course framework. So we are definitely looking forward to that and excited. So save the date for March the 17th. It'll be here in Central Ohio at the Renaissance. If you have any questions about that, you're welcome to connect with me, and I'm happy to answer any questions that you have. We also have a trauma sensitive mindfulness practice groups that are coming out, and I will share the link with all of you as well. Those are going to take place Tuesdays and Thursdays starting in mid-January. These are opportunities for people to learn some trauma sensitive mindfulness practices in their roles as family members as well as caregivers. So I will send a link for that information and the follow-up email that I will send to everybody who has joined us today and registered for today. We are short on time. It was our intention to have an opportunity to have time with department leadership and to hear from folks, but we are unfortunately out of time. I am excited to share, though, that we do have an opportunity to connect in January. Save the date and hold your calendar for January the 17th at 11:30. That morning, I will send a link out to everybody who's registered for this FAC, and we will have time with Director Hauk and hear from all of you and then have a conversation. I do apologize we weren't able to get to it today. Our presentations have gone much longer than we anticipated. Although it's been good information and helpful information and very resourceful, we do find ourselves out of time at this particular moment. That being said, if you have immediate concerns or questions or anything at all, you are more than welcome to connect with Meredith and I. And also, if you want to connect with Nate, we can connect you with Nate. He is a tremendous resource, and we are tremendously excited to have him with us. But do not hesitate to reach out to any of us if you have questions or need some assistance or information. And then we will have our next official Family Advisory Council meeting on March the 15th, 2023. Meredith will get the information out to everybody in the weeks ahead, and then again save the date for January the 17th at 11:30, and I will send the meeting link out that morning for us to have time to connect with our DODD leadership team. We do appreciate everybody being here today. Again, anticipate an email coming from me that'll have links and resources and PowerPoints that have been shared with all of you today. And again, never hesitate to connect and reach out with Meredith, Nate, or I if we could be of any support for you. And I apologize, I haven't been able to keep up with the chat here most recently, but I will make sure I take a peek at those and we follow up with individuals as well. So we are at 1:30. Again, thank you everybody for being here. We look forward to hearing from you and seeing you definitely at our next Family Advisory Council in March of 2023. Have a wonderful holiday and a great new year. And thank you again.